Welcome back to the Queens of Quality. I'm here today with our co-host Jen.
Hi, Michelleanne.
Hi, Jen. We're back again with Steve Thompson.
Hello.
And we're here to introduce Emily Barker. Emily, tell us a little bit about you.
Hi, all. I have a unique background. I've spent the last 10 years in tech, working at Cisco Systems. And then the 10 years prior to that was in academia and biotech and biopharma. So I kind of bring together the culmination of both the regulatory and compliance on the biopharma side with the tech and AI side that we've been discussing.
Excellent. Thank you. So we are back together today to talk more about AI, ethics in AI, and the building of an algorithm review board to ensure that we have what we need so that we're doing the pre-work and not the rework. Who wants to kick it off?
Well, I know that we had 2 episodes, and that was last year. Seems like long ago, but it wasn't too long ago. And then we all took a much needed break. And so now we're rolling into 2024, and this is the year it's going to happen. And so it's early, obviously, we're just starting out. And so I would encourage folks to go listen to the previous 2 episodes. If you're wondering what we're talking about right now, very exciting, because we want to use technologies ethically, and we want to avoid catastrophe, like we have all talked in the prior episodes. And so right now we're moving into 2024 to really get this started. And it's very exciting, but it's in the early stages, meaning that it's wide open so people can get involved and help shape this.
Yeah. So, Steve, what I heard you say is that we've already talked about the problem, and now we're getting into the solution, or at least one of the possible solutions. So, again, it is a vast landscape that we're talking about. So how do we whittle that down into something that we can actually do as part of the IRB?
Right. And I know, I mean, we were meeting before. It's almost like we meet and our meetings are much longer than the actually podcast, and it's just more and more and more come up. And that's the problem, right? There's so much we could go down rabbit holes. We can get confused. And that's what we really want to do, is unconfuse this, bring the advanced technologies into lay person's terms so we can apply them ethically and avoid a catastrophe like we've been saying. So yeah, so the solution, we believe, is something like the ARB, and like we've talked in the previous episodes, it's modeled basically after an IRB, which is good for the clinical trials aspect of it. And we're basically just applying that type of ethics committee that's a multidisciplinary team of different folks all together to help shape the future of what this can be. And I know the other thing is, you know, when we talk, there's so many technologies out there in terms and definitions and everything that's another thing that we could start right now, is helping define, to clarify, to speak the same language. Speaking the same language is one of the first steps that we can do in establishing this. I know we were just talking about that earlier.
Right. And I feel like, you know, Michelleanne, you can keep me honest on this. I think I've said I'll go with more than one of our previous podcasts where, you know, we use the same words, but sometimes we speak a different language. So to your point, Steve, how do we ensure that, because this space is so complex, you know, we need to actually start to define what our language is for this area. And I think that lexicon that you mentioned is a great start.
And for me, you know, I love that we have actually defined a new term, the ARB, but it almost overcomplicates everything we've got here because there's so many new terms. So when I looked at the ARB, the algorithm review board, and then I compare it to my institutional review board that I know from my academic background, really the piece that stood out for me is the ability to peer review and the ability to reproduce. And so when we're talking about AI, the cool thing is that it's different every time. Every time AI runs, it has a slightly different result, and it's constantly getting different. As to whether it's getting better or not, that's, up to someone's opinion, but it's always getting different. And so if we're looking at how can we peer review or thing that is ever changing, what does that look like? And, what we could do potentially is we can look at, okay, can this be plus or minus 3, plus or minus 6, plus or minus the square root of whatever, so can we have some wiggle room to judge that algorithm as being reproduced? Because in and of itself, it can't be reproduced.
Yeah. So, Emily, I want to take a quick step back in terms of what you were talking about in terms of the IRB relative to an ARB. So for those who are not in the industry, some of the key aspects that the IRB will look at is when it does a peer review. Again, we talked in the last episode about how we need these perspectives from all different walks of life, because again, an IRB has a very diverse mix of participants, and it looks at the methodology for the protocols that are coming through to ensure that they are reproducible. So is it so complicated, or do they use bespoke technology or the new math to see that these things can actually get reproduced? So those are really key topics and key aspects that the IRB will look at. So from an ARB perspective, and this is where I'm going to show my naivete in this space in an effort to help educate those who are listening. Okay, I'm selfish. I want you guys to educate me. So when you talk about the algorithm, right? So I'm used to an algorithm, fine. I know that Google knows my specific likes, and it knows when I'm going to go buy shopping. When I go shopping, so it's figured out, what I like and what I don't like, kind of thing. I'm always fascinated by the feed I get on my Instagram, where I think of something and it pops up on my feed, So those are the algorithms I'm familiar with from a day-to-day perspective. So when it comes to the AI piece, Emily, you said something that was really made my ears perk up, where you talked about it's constantly changing. Better or worse is not for us to say at this point, but it's changing. Can you get into that a little bit more, or between Michelleanne, Steve, and yourself, can you all kind of talk about that changeability within an algorithm a little bit more to help people who don't understand? That would be me. To really, help understand why that's important within this context.
So when we talk about just the term artificial intelligence, the intelligence aspect of that name comes from the fact that it is ever changing, ever learning, ever evolving. And so that is why we are here, and why we're even talking about AI, is because it is always changing, and it is always evolving, and it is always learning. And the reason why I talk about good, bad is up to judgment is that we've had some really poignant examples of where we've seen some of these chat GPT examples of the algorithms have all of a sudden gone the wrong way and started giving the wrong answers because the data that they were pulling from had essentially been poisoned and was now giving the wrong information. And so that's where we can kind of turn that bad chat GPT algorithm, we can turn it around with good data, but we can't get it back to the exact point because it's ever changing and ever evolving.
So it seems like it is kind of scary, right? When you hear ever changing, ever evolving, it is very scary sometimes. But we human beings are ever changing, ever evolving, right? And so how do we control ourselves, right? We have quality systems, we have procedures in place, processes in place. So it's the same thing with artificial intelligence. How can we look at controls, procedures, processes, so it's not wide open, the wild, wild west, trains running off the track and everything. So that's kind of a purpose of the envision of the ARB. And it's almost like, why algorithm review board? Why not technology review board, whatever? But when you really think about it, the algorithm is the process of processing, redundant, process of processing information, the methodology of processing the information. So the algorithm is the process, the gears turning behind, and it applies to hardware, blah, blah, blah. Don't want to dive in, go down a rabbit hole there. But the algorithm is really important because that's how it processes things. And there is a hierarchy of data, and it starts with data, bits and bytes, data, information, knowledge, and wisdom. Wisdom is at the top of the pyramid. Underneath wisdom is knowledge, then it's information, and data is at the very bottom. So when we're talking about these technologies, we're really talking, and Emily, you were mentioning it, bias of the data. That's in the information and data piece of it. So the algorithms will be looking at the data, and they can make wrong or right or kind of right decisions. They can even hallucinate, right? So the algorithms themselves will make up stuff if we're not careful. And that's true. And so we need the humans in the loop, and that is the knowledge and the wisdom at the top. And the ARB is the collective group of individuals that are doing the knowledge and the wisdom to make sure that we're processing the information and data appropriately.
So Steve, I just had visions of Skynet on mushrooms, right? I'm just saying.
And there's a whole, if you look at Deep Dream, you'll see how how Google learned all of this. And apparently it does look like, I guess, an acid trip from the 60s. I never was there to do that. But anyway, it's fascinating to look to see how it learns. But to Emily's point, yeah, things can go off the rails, but that's the whole purpose of what we're talking about here. We're trying to look at process and controls and strategies so we could use these advanced technologies, including artificial intelligence.
See, and part of what I look at with it is, we want to set it so that it's replicable, right? We want to be able to repeat it over and over and over again. So to bring it a little bit wider, and where we could functionally use this very well within drug development, GMP is a perfect place for that, because GMP is very black and white, right? You follow the recipe, you do not deviate from the recipe. These are the steps that you take. This is the order you take it in. And if you do the steps in the order with the right ingredients, you will come up with the same output over and over and over again, because that's what you're looking for, is the replicability. Algorithms that are changing, that's where you get more into the clinical piece, right? So for me, the way that I look at it is, in the GMP, it's a one-to-one relationship. In the GCP world, it's a one-to-many relationship, to use, logic language, right? Mm-hmm. So you have relational, and the way that I kind of described it in a meeting that I was in yesterday, where we were talking about AI and pharmacovigilance, was the same way that you would have a protocol with many arms. That's the way the algorithms work within the use of AI. You're assigning multiple arms because there's multiple possibilities.
Right.
Okay, so I want to see if I can summarize this. So or to draw appropriate parallels, I guess, is probably a better word to use. So we were talking about the algorithm piece of it. And if we look at the algorithm in and of itself as essentially the testing methodology, is that a good parallel to draw in terms of the reproducibility or replicability that we're discussing to ensure that, again, we can get the same results over and over again, even if we have some sort of variation in it, as if you would in a clinical trial with many arms.
So if you like, okay, so it is ever changing, right? And it's like, how can we do that? But Michelleanne, you just mentioned it, right? Biology is ever changing, chemistry, right? So if we could do that in clinical trials and have control mechanisms in place to handle that. And it goes to Emily's point about statistical significance and kind of alluding to standard deviations and all that. So mathematically, we can apply these things as well. But I mean, I kind of went like a little bit deep there, but it can be really simple, right? What's reproducibility? I can train an algorithm to recognize a dog. That may be the very first is look at a dog versus a cat versus a bird. And it can start identifying dogs versus cats and birds. As it gets better and better and better, it could start identifying pugs, pit bulls, chihuahuas. You know, it could get more intelligent, right? It's learning, it's changing, it's artificial intelligence. It's becoming more intelligent. Or your algorithm is wrong, and before you know it, we didn't figure it out, and now it thinks a hyena is a chihuahua or something like that, you know, or some cat is something. You know, that's where the algorithms go way off board. And so how can we put those in place and give guidance to help people out? And if I think about it, right, let's say I'm just a programmer and I get this assignment, I've got to develop this algorithm or whatever, and I don't understand life sciences. It would be really great if there's a group of people I can go to that says, hey, I need to develop this. Can you help me out on making sure I'm using the right algorithm, supervised, unsupervised, whatever the case may be? Or how could I look at my data to make sure my data isn't biased? What controls can I put in place? And to Emily's point, you know, what is statistical significance of when something is acceptable and not acceptable? That's how I would think the ARB can function. It's a place that people can go to kind of as a sanity check, you know, and figure out how to apply this, even though right now it's wide open and kind of insane, everything that's happening, but we will get there.
But is it a place that they can go to or a place that they have to go to? You know, if we talk about an IRB, like there is no getting around an institutional review board when you're trying to do a study. And so,
right,
you know, would we be putting the same restrictions in place with an ARB saying, if you want to use AI, machine learning in biopharma, this is what you have to do? You know, are we going to try and do that?
I think at the early stages right now, industry needs their hand to be held, not to be slapped.
Yeah. So again, I'm going to come back to what I hear you both saying, because I appreciate that you have more wisdom in this area than I do. Yeah. Steve, once again, I love the fact that you brought in that pyramid, because I talk about the knowledge pyramid a lot in what I do. You know, so you have information, you have data, information, knowledge, and then wisdom. Obviously, when it comes to algorithms, we're talking data. You know, so with that, and Emily, to your point about, you know, how do we actually mandate this? I know one of the things that we had talked about last podcast was around it being, you know, mandated by essentially bureaucrats, let's call a spade, you know, who don't necessarily understand the space and may end up binding ourselves into a position where we can't really operate well within it and no one really understands it. Refer to 21 CFR part 11, you know?
Mhm.
So for what we're looking to do, again, it's a good idea. You know, it is one of those things where, you know, it is highly recommended before you're told you have to do it. It's kind of like when my doctor tells me I need to change my diet. It is highly recommended for you to have to do these things. You know, eventually he's going to just, or she's going to just tell me, if you don't do it, you're going to run into other issues. So listen to your doctor. Or the
So
podcast.
I mean, we've had really good conversations. I mean, there's no doubt that there's interest in it and talking to other folks. People want to be a part of this. And we're just thinking out loud, right? Right now, we're kind of thinking out loud via a podcast, but it is starting to take shape, and it's important for people to get involved. We don't have the answers yet. We have a lot of ideas, and we think we have a mechanism, but that's why we really need diverse. And Emily, it's great with your background. It brings a whole new facet in here that we didn't have in 2023. Now we have it in 2024. So it's growing, it's happening. So it's important for people to get involved with this and help us shape this the right way. So it will be helpful, not a hindrance.
And so I want to bring up a couple of points here. So being helpful, not a hindrance, we need to make sure, and this is another reiteration that's coming from the meeting that I was in yesterday, we need to make sure that the people who need to be at the table are at the table from the start. So if you are listening to this, we mean you. And we are going to put together, we talked about this before we started today, we are going to put together a, basically a lexicon, with a breakdown of the terms and definitions and acronyms, because we are heading into new territory, right? So we want to make sure that we are bringing everyone with us, because goodness knows what this industry needed more than anything else is more 3-letter acronyms.
Agreed.
Well, I mean, you bring up, so there are definitions out there for artificial intelligence and all of these other technologies, which we'll be mentioning. We're throwing out all of these buzzwords and technologies and blockchain and artificial, blah, 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 all this other stuff. But what's really important for our life sciences industry is the terms and definitions, not to isolate ourselves, but to draw connections and correlations between these advanced technologies and how we in life sciences, whether you're GMP, GLP, GCP, or whatever GXP you're operating in, we can draw the connections between these technological terms versus the life sciences terms.
Exactly. And I also wanted to go back to a point that was brought up earlier about we need to be drawing more people in, more in, and not like slapping them on the hand kind of thing. This is the time, like this is where we have the opportunity to define this, right? And to be able to say, we're doing this. We need to make sure we're doing it in an ethical way. We need to make sure that we're doing the pre-work and not the rework. That's one of my favorite little catchphrases, is we do the pre-work and not the rework. Because this isn't going to instantly, like, I've seen this with so many advances in technology across the industry throughout the years. This doesn't mean that, oh my goodness, everybody's now out of jobs. Actually, this means that we need the really smart people to chime in and start going through this stuff so that we can set this up, because we're trying to work smarter and not harder.
Absolutely.
That's one of my favorites.
Yes, absolutely.
That's one of my favorite bumper stickers. So again, this is a very complicated topic. So with the first episode, we kind of introduced the whole AI idea. The second episode of our mini series, season 2.5, we've talked about the ARB in and of itself. And now we're getting into what the algorithm really looks like and how does that, not necessarily what it looks like, because they're all going to look different. So excuse me for that. So we're looking at the algorithm in and of itself as the methodology, and how do we essentially manage that within the construct of a clinical trial and scientific study, so that we can put those criteria, I'm going to call it, because I don't even want to call it guide rails. I feel like that's even too restrictive. We can put some criteria around it so that, again, we can have that reproducibility and be able to replicate it, as well as, the key thing that Emily mentioned at the very beginning was about that peer review, because we want people who are not necessarily industry experts, to have that perspective. How do we explain what is happening for people who are like me and not necessarily experts in the area and can, read code? I don't see code. The only language I speak is sarcasm. So that's really where, the next episode, again, is going to kind of tie it all together, as well as you kind of get to the last part of our mini series here, in terms of the idea of how do we actually manage and learn to leverage the technology that we have and have it enhance what we're doing, versus fumbling like we have in our pasts and created more trouble for ourselves than we needed to, and then having others slap our hands, instead of hold our hands. Steve, I really, that's the bumper sticker from today's episode is let's hold hands and not slap hands.
We'll slap hands later when we figure it out.
No.
Because that's the thing, right? Like we're here to support each other through this, and this is something that, if you go back through the episodes, I cannot remember how many times we have talked about not creating this in silo, not, everybody's got to work together, bringing the people to the table. Like, this is a real opportunity to bring the people to the table, to make sure that we're doing this in an ethical manner, to ensure that we have all of the bits and all of the parts. How can we do this so that it's compliant with GDPR? How do we do this so that the data is, usable,
reproducible, and it has high integrity?
Yes, those parts. Like, how do we make sure we get there? And that's what we're going to be talking about next.
So stay tuned, everybody.
Thank you very much, everyone, for joining us. And if you have any questions, concerns, comments, please, I cannot encourage this enough. Reach out to us at hello@metisconsultingservices.com. Jennifer, Steve, Emily, and I are all available. We want to hear from you. Come to the table.
Absolutely.
Thanks, y'all.
Thanks, everyone.
Thanks all.
Thanks. Bye.
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 Good deal.
I just have to figure out how to stop the recording.
Stop. Sorry, Brianna.